they say Nima that development. Nima ya see oh, Nima ya see oh, ya go Nima ya see oh, Nima ya see oh. We are warriors, conquerors, we never lose a battle. We are leaders, Kwalo Nima oh, Kwanto go, Kwalo Nima oh, Kwanto go, Kwayo, Kawekata Kwayo, Nima, Make Kwayo.
This is platform for education. We are here to just give you some health education. Like they always say, the more you educate the community, the better the community becomes. And when the community is educated, the town is educated, the city is educated, and the country is educated, then we have a better life. So we come here Monday, Wednesday, and Friday to educate our fellow friends, sister, brothers, mother, father, you know, about how we take care of our body. You know, the more you learn about the care of your body, the better you become and the longer you live. That means you know what to eat, you know what exercise to take, you know what to do to yourself not to get sick. And when you are sick, you cause more cortisone to be secreted, and cortisone is the one that constricts your blood vessel. So it only come on when you are angry, it come on when you are depressed, it come on when you are doing anything that's not satisfying to you. But when you are happy, cortisone is not going to be secreted. You don't want to be looking bad before your time. Don't allow cortisone to be secreted. So we're here to talk about the care of our body. So this morning we'll be talking about what people usually call chemotherapy. You always hear some people say, "Oh, this person has he has cancer, so they're putting him on chemotherapy." Chemotherapy. They just use the word chemotherapy because most of the time, people who have cancer, they gave them this particular medicine, but chemotherapy is not particularly for cancer. You can use chemotherapy to treat any disease in the body because it goes into all part of the body. They can use X-ray to treat cancer also. They can use surgical procedure. You can operate the person to remove a cancer cell. Where the cancer is, you can go there and then cut that whole area and remove it. Then the person will go cancer free. You can take the X-ray, the light of the X-ray, and put the beam high, and you know that the person had cancer on a particular part of the leg, and you focus that beam there and you turn that on, okay, that radiation, it will kill the cancer cell. The only thing about that one is that it doesn't distinguish which cell is bad, which cell is good. So cancer cell and the good cell, so cancer cell is the bad cell. The good cell is your own body's blood cell will all go. They all will be killed by that radiation. Same thing with the chemotherapy. The chemotherapy is going to kill the cancer cell, it's going to destroy the cancer cell just as well as the normal blood cell. You see? So, chemotherapy actually is not only for cancer treatment. You can use it to treat what we call septicemia. When somebody develops an infection of the blood and they all over the blood, you treat that person with a particular drug to kill it, it becomes chemo. Okay? So it is not only for that. No, so when doctor is diagnosing, you know, when the chemotherapy that we use to treat this cancer, there are two different types of cancer we have. One cancer is a cancer that can spread. We call that malignant. That it can just spread. It grow and it start growing, it start spreading all around. Another cancer is benign. That's the one that is just sitting there. That cell, it had just come together. It grew and then just come together like a lump, like a pancreas, not sitting under the tissue or under the skin. It just sit there. It doesn't spread. It doesn't go anywhere. It's also a cancer, but it doesn't do anything to you because we call that benign. Benign cancer, somebody can get it and go do all they want to do because they don't need chemo. You only need chemo to treat a cancer that's going to spread, that will go all over your body. Because when it hit your brain tissue, it becomes bad. It hit any of the organ tissue, it becomes bad. So that's why you don't want that cancer cell to go travel all around. So you start treating with this particular medicine you call chemo. Okay, that's why you use chemo therapy. So you use it for a cancer that can spread. Not the other cancer that does not spread. The one that does not spread is the benign one that does not spread. It's just sitting there. It doesn't cause you trouble. That's why the people say, if it is not broken, don't fix it. Okay? That cup is not broken, don't put glue on it. You see? The cancer is under your skin right there, on your knee. Does it bother you? On your knee, you're walking straight, right? When you're walking, do you feel pain? No. All right. The one that can bother you when you're walking, you feel pain. When you're walking, you're breathing fast. Those are the ones you want to get rid of with chemo. All right. And you see, if the cancer is localized, it is easier to treat it with something like a radiation. It is easier to treat it with something like surgery. Localized cancer are the one that you can treat with cancer with surgery. Let's say you want to take your bath and you start testing, you start checking your scrotum. When you go to check your scrotum, you find out that one of the testicles in the scrotum is bigger than the other one. So you don't feel good. So you go to the doctor. The doctor says, let's check that. Okay, yeah, one is actually bigger. Let me do a test and find out what happening. Then they went there and then put a needle in the scrotum in that testicle and take a little tissue. They tested to find out that it's a cancer cell. So they don't want that to spread from the testicle to any part to the other testicle. So what they were going to do, they will just take you and put you on that table and just cut that whole scrotum open and take that testicle off from there easy and just sew you right back. You all good and you ready to go.
So you're gonna have that one.
So you have one. That one that you have is left with you. It's left with you to eat right, not to be sick, not to develop gonorrhea, not to develop chlamydia. You know, so that you not to develop syphilis. Maybe now next time when we come, we will discuss syphilis. Not to develop any of those, because when you develop it, it destroys those tubes that can bring the sperm that will be able to make you to born a baby. So they will take that testicle that they found out that it has a cancer cell, they will take it out. That surgical method, surgical procedure, they will use it and take that testicle off and get it away from there. You are all good. No problem with that. You all will live long. You see, that's why it is better when you go to take bath, you listen to some of these things we say, so that when you go to take bath, you know how to examine yourself. It is not all the time you have to go to the doctor to examine yourself, but we tell you what to do when you go to take your bath, to examine yourself. How the woman examine her breast. You know, most of the time they're going for mammogram. Okay, fine, but try to examine yourself to make sure that you don't feel knocked in any of the underside of the breast. Try to examine yourself. You the man, to feel that your testicle, your testicle in the scrotum is all soft and nice and are the same size, not a big. And you make sure that all two are there, not one. You know, all those things you check on them. All right, you always check on that. Make sure that when you check your body, when you're taking bath, no part of your body is swelling and you see one just swelling, or some part of you is swelling and it's hurting, and it just been there for a certain time. It hurt, but it don't hurt that much, but it just hurting small. But then you don't take notice about that. No, always be careful. The more you careful with your body and you check yourself and you know that these things are all right to do, when something go wrong, it will be easy. When we find out that something is growing, the earlier we detect it, the better it is to get it out with that and you live a normal life. But people are afraid to go to the hospital, the way that this thing going on. That's why you do your mammogram when you are in the 50s, the women, and when you are 30, 40, you go to the hospital and do your PSA. That's that's for your prostate, to check it out. That's why when you are in the 40 or 50, both men and women, you go and do your colonoscopy. We checking in the colon, especially the large intestine. We want to check over there because cancer most of the time develop down there. So they want to check that, because most of the time, you know why? More people who go 2 weeks, they can't go in the toilet. Tell me what's happening over there. What is happening over there? All the food you're eating is just partying up. You don't go in the toilet. So when you run in your 50, they want to make sure. Because if you got stool just sitting over there for a whole 2 weeks, bacteria in that stool already. Bacteria in our stool, and they stay over there and they just get bad, and then when you drink water, it mixes with the stool, then the stool swell, okay, and it expands the colon. So what is happening? Any of those tissues will start growing on top of another one. You got big problem coming. So it's always good you eat soft and make sure that you go in the latrine. When you toilet, at least 1 day, 2 day go. 1 day, 2 day go. But by right, when you eat, you're supposed to go in the latrine. When you eat, you go in the latrine. When you eat, you go in the latrine, because it's not going to take 5 days for the food to digest, except that you just swallowing the food without being chewing it. That's why you got to first of all digest the food in your mouth before you can even swallow to go in your stomach. So that's why it is better to eat. And those are the things that we do. Those are the tests that we do. You do your colonoscopy. You do your prostate. You go. The woman go and do the mammogram. The woman go and do pap smear to see that nothing is developing on the ovary, in the uterus, and all those things. You got to keep checking on these things. These are the simple tests that you do. It's not costly to do these tests, you see, but it is costly to cure. It is costly to control. It is costly to do prevention. It is costly to treat for comfort. You see, so when somebody is being treated with chemotherapy, the doctor usually consider 3 goals. They say, okay, we know that you got this cancer, but we will put you on chemotherapy. But our goal are either to kill you so that the cancer will not come back, or to control the cancer so that it will not spread, it will just stay in one place, or the cancer has already spread, but to give you comfort so that you can't feel pain. We give you medicine so that you can't feel pain, because the cancer will be causing you pain. Those are the three goals the doctor always talk about. But when they talk about the first one, to kill you, that one the doctor mostly do not too much concentrate on curative, because they know that they cannot guarantee curative. Curative means that they kill you, the cancer cell is completely dead, because when they put in, the only reason the doctor will talk about curative, when the cancer is localized, he do the operation and take out that part of the body out and nothing left there, then he makes sure of curative. But when he giving you chemotherapy, he will say intended curative intent. You know, we want to give you the medicine with curative intent. We don't know whether it will completely cure, because it takes many years to come up with definitive answer as to know whether you are cured. It takes long time to figure out that. So they don't come up with the definitive answer. Okay, the chemotherapy is going to kill you. No, they won't come with that. But they will be thinking about that. So they will start with that goal. All right, curative. The next goal they will go to control. You know, when they know that the cancer had already, you already determined that there's a cancer there, they don't want that cancer to spread. So what you want to do? You want to arrest that cancer with the chemotherapy so that it cannot grow no longer. It cannot grow, it can't spread. It can't go anywhere. So anywhere they see that cancer, the cell will, you know, what will happen? It will kill the cell. It will kill the cell. They will shrinking. If the cancer is here, they will keep shrinking that little mass, so that mass will not spread, get bigger, and then burst into the blood cell. So they will start giving you the chemo, and the chemo will shrink this. It will keep shrinking that. It will keep shrinking that. It will keep shrinking that. That being controlled. It will be shrinking it, keep it under control, so it will not spread. You see, those are some of the goals. Those are that is the second goal doctor will be thinking about. Can we give you chemo to control this? Okay, the more you come to take the chemo, they will be giving you tests to see where your hemoglobin is developing more better. You are not becoming anemic. The doctor will be happy now. Yeah, fine, because chemo is going to destroy the blood cell also. Okay.
Okay, Mr. P, let me ask you.
Okay.
When you have a cancer in the blood,
the leukemia.
Yeah. So, they still do the same chemo?
They're still going to give you chemo. They're still going to give you.
Is that curable? It can get better?
No, the thing is, that's what we're talking about. When they're giving you chemo, they will be thinking that you can be cured, but they can't guarantee it. You see, they cannot guarantee it. You see, leukemia, cancer of the blood cell, that one is very bad sometimes. But they can put you on that chemo and hoping that it's going to be all right. Okay, as you keep taking it, it may be all right. You see, based on the age too. You see, more children can get cured with leukemia, and they live a little bit longer time. But they have to be watching them as they grow, because you can't determine that this person is going to be cured on chemo right away. No, it takes many years to do that.
You see, that's one of the things that really
it takes many years to do that.
It's really affecting the Liberian community.
Yeah,
a lot of people dying from cancer. There's a whole lot of people dying from cancer.
Yeah, because first of all, we have not understood how to check ourselves. What are those things? We don't have the medical facility. We don't have that chance, that opportunity to go to the hospital and check on all these things. You know, some people sit in the village. They come a normal. They see their normal growth. It still growing. Then they just look at it growing. You know, people develop goiter of the thyroid. It's still growing. you know, and all those things. Nobody know.
Sometimes they consider you to be in wish.
Okay, that's what they will do back home.
Yeah, they may
You see?
or something.
And
Let's take a break.
so we will take a break and come back, and we will tell you control and the palliative when you're treating cancer for just comfort.
It's Crown Up Boy, yeah. I too happy you came my way. Oh, da. Soon on day break like your face I wanna see. I just wanna be loving you. Like just how I wanna be. I will ride for you like Gange. Now I want you, you not pamble. I love you, don't tante. Oh, got me singing like morning, oh, morning, baby. I just wanna sing morning, oh, morning, baby. Got a song for you, yeah, yeah. Morning, oh, morning, baby. I'm in love with you. Morning, oh, morning, baby. When you smile, the whole world freeze. Oh, da. When you pose, no need to say cheese. Oh, no. Your beauty, that newsletter and carry the cheese. Oh, yeah. No competition, you take it with ease. Put that, you not put that on my heart, oh. For nobody, wherever your spot, oh. Morning, oh, morning, baby. Morning, oh, morning, baby. Morning, oh, morning, baby. Morning, oh, morning, baby. Ellie with my bone, I won't pour you in glass. Oh yeah. Fly salmon and touch you when you pass. You find like a man and go out there. Oh yeah. You too metro, you not like fries. You my everyday new thing. Go for bed party in the daily, oh. Me I like good thing. Let people don't want you, oh. Morning, baby. I just wanna sing. Morning, oh, morning, baby. Got a song for you, yeah. Morning, oh, morning, baby. Morning, oh, morning, baby. I'm in love with you. Hold on. King Java, see you, papi, oh yeah. It's Crown Up Boy, yeah. I too happy you came my way. Oh, da. Soon on day break like your face I wanna see.
Good morning, we are back. This is Lrtn, Liberian Radio and Television Network, based here in Philadelphia, Pennsylvania, United States of America. So we are discussing chemo with the goal of curative, control, and palliation. Control, like we said, when the doctor is giving chemotherapy with the intention to control the cancer, that means they are sure that the cancer is not spreading any longer. They are shrinking the particular area or the particular lump that, you know, from which the cells is being released. They're shrinking that particular area, so it's being under control right there. All right. But when they start giving you chemotherapy with the intention of palliation, then the cancer has gone to what we call advanced level. That means they can't hold it back no more. The cancer got to do you what the cancer want to do you.
Wow.
You see, that's the time now the doctor will say, okay, we gave you so time to live. We believe that from now until this time, the cancer cell will take all over your heart, it will take all over your brain and everything like that.
Wow.
You see, then they're giving you now that chemotherapy with that particular intention. They call that palliation. So chemotherapy given with the intention of palliation is not good. That's the advanced stage of cancer. All right. Curative is good. They can, incise the scrotum and take the testicle. That curative right there. They can take the lump on your knee and put the X-ray beam on it, and it kill the cell from right there on your knee. That's good there. And it can be controlled from there also. All right. They can give you chemotherapy to stop the cancer cell, to kill the cancer cell from going around. Okay, that they're controlling it. And each time you go there, they check the particular area. They find out that this knock is reducing in size, that being controlled. But when they start giving you the chemotherapy with the intention of palliation, it becomes an advanced stage of the cancer. They don't want that. Nobody want that. It's very bad. Okay, that's what we do. That's what happened. So chemotherapy, it doesn't hurt. It's something like they just put the IV. They just give you an IV right away. And you will not feel any pain. It's in your body. It's in your body. It's going all over. Both your red cell, your cancer cell will all be, destroyed by that chemotherapy. That's why if you don't have enough blood cell, you don't have enough red cell, and you're going for chemo, it's going to make it a little bit worse.
Can you get
then it will be exposed. You will be more vulnerable, that you can get a little infection and it can overcome you, because you already anemic, and you are going to be taking something to make you more anemic. So it is not the right thing, to do.
So Mr. P, they got medication that you can take. Do they have a medication you can take without doing the chemo?
You can take. Normally, they will not give you any medicine from the drugstore, any chemical, any prescription drug.
Oh, yeah.
They will not give it to you to say, oh, you can don't take chemo, just take the medicine. No, they're not going to do that. And as long as they call it cancer, they are going to put you on that chemo. They are nothing else, except people who say, look, you know what, I'm going to take green juice.
What is green juice?
Green juice means that some people will get up and start taking, you see aloe vera leaf, you see kale leaf, you see green apple.
Yeah.
Okay. Then they will juice those things in green apple, kales, aloe vera, cucumber, and put those juice together. And they will juice it as much as they can and put it down in their refrigerator. Then they will start eating green vegetable. They face the green beans, the fresh green beans, the fresh pepper, green pepper.
Everything got to be green.
Yes, they will start eating all that will be green. They will not eat any more oil.
To be able to build the red,
because the more they eat the green, it gave them iron. That's the source of red blood cell. It gave them more iron. So some people like that, they keep doing it for that time. You will see at certain time when they come back, they go to the hospital, they will say, oh, we thought the cancer was there, but the cancer has shrunk, or the cancer is no longer there.
Oh.
Yeah, some people can put themselves on that kind of treatment, but they will be confined to that. Everything they eat during the day from that time, everything will be that juice. So
you straight on that diet?
They straight completely on that diet. That's what some people have done before. They have done that before. But that is not something that they recommend. They don't recommend those things. But only
you gotta say you want it, right?
Yeah,
it gotta be your consent.
They will not tell you go and do that. They will only tell you, the doctor will only tell you, say, okay, you know what, you got this cancer. All right? We feel that we should put you on chemotherapy right now. The cancer may be in stage 1, it may be in stage 2, but the cancer that you have is not benign. Okay? it can metastasize, it can spread. So we want to put you on chemo, but our goal is to help you, you know, we feel that you may be cured, so we come with the intended curative goal. Then we come with control, the goal to control it. All right? But they cannot tell you, say, oh, go and drink this one. They don't, that it is not something that they feel that they had not found any evidence that can cure cancer. If that was the case, then they were told. Many people say, oh, go and do this, go and take this drink. But only other people who say, you know what, I have seen people doing this, let me go and do it myself. And they go and do that. You see? They go and do that. So, and some of them come out complete. You know, it helps some of them. You know, but for what is recommended, for what is evidence, is what we call today as chemotherapy. Chemotherapy. But only chemotherapy is to, when you treat anybody, any disease in the body, and you put that medicine in the body, in the skin or in the body, and that medicine is to spread all over the body, it is chemo. As long as it's going to fight infection all over the body, it is considered chemo. So that's one of the information we want people to know when they say, oh, we're treating you. Suppose somebody got septicemia, somebody got the
so that every chemo, Tony, you doing mean you got cancer?
No, it's not anything you take.
So that's clear. So for the audience,
yes,
because somebody go for chemo, you think they got cancer?
You know, right? And by right, you go to the hospital, they say, okay, look at malaria. Okay, they take malaria, they take chloroquine and give you injection, right? They take the chloroquine and give you injection. That chloroquine will go all over. It becomes chemo. Chemo is intended to kill disease all over the body.
Okay.
That it becomes chemo as long as it is inside the body to kill diseases all over. It becomes chemo. Chemo is not only for cancer treatment. But the only thing they have put it together, because when they're giving you that medicine as a means of treatment, let's say they put the eye morphine, all right?
Yeah.
If the cancer get to a advanced stage, and it causing you pain, the eye morphine into the chemotherapy.
Okay, to stop the pain.
To stop the pain.
Wow.
Then at that time they're giving that the reason at that time they're giving you that morphine and the chemo together is for comfort.
Oh, comfort. Oh, which means they can't do anything.
They can't do anything, just so that you will feel comfortable.
You can't just be hurting all the time.
Yeah, so you will not be painful.
Yeah,
you will not
because
be
I know I
because
got a friend, mom, who she was in a terrible state. So
okay.
Yeah, she used to feel pain all the time. Later on, they started giving that to her.
Okay, they start giving you.
She passed anyway.
Okay, that's how it happened. That's what happened. So in no kind of case, they will not even allow you. Some people will say, look, we will not allow this our relative to stay in the hospital to continue on chemo. Let's put this person on hospice. That's a place called hospital. They keep that person there for a certain time and keep giving them. We keep giving them morphine maybe every 8 hours. Okay. We give them morphine. Now within that time, they are feeling very fine, comfortable. It keep them sleeping. It just keep them sleeping. You just dose them to sleep. They are sleeping, no pain. They're not crying. They just feeling sleepy, and they will be doing it that way until they just pass. They will not feel anyway. That hospital treatment.
Yeah, okay.
That's how we do with hospital.
Hospital, yeah, okay. For the audience, everybody that is watching, hey, Robert Anderson, how you doing? AK is watching. So Carolina, Bendu, Benedict. Oh, I see everybody on here. If you have a question, the number is at the bottom of the screen. You can call that number and ask your question. And this is Mr. P is talking on the chemo. Okay,
We're
on
talking
chemotherapy.
and the goal of
chemotherapy.
the goal that the doctor will always look
Yeah,
at when
so-
when they're treating you with chemo.
Yeah. So now everybody that goes to chemotherapy means
You
you
know,
got cancer.
You can't say, oh, as a matter of fact, any medicine they give it to you to go into your body that will work all around it is chemo.
Yeah. Okay.
It is chemo. So you can't just say, oh, because they give it to him, oh, because he on chemo that. So I can take any medicine they can put injection, so they can give me a pneumonia vaccine, or they can give me somebody can have a pneumonia. You go to the hospital, we'll put you down and give you an IV, we'll put the IV on you. Then we say, okay, since he got a pneumonia, let's get the man gentamicin, let's get the man ampicillin IV. We start giving it becomes chemo. It is chemo. It's going to fight that infection or that bacteria all over in the body.
Okay.
All over any treatment that's going to go all over part of your body is considered chemo. You see, those are some of the things that we want you to understand. Chemo is not only for the cancer. No, it's not all that. Because we know cancer cell can spread just like any other disease. Can be all over the body. You see? So that's what we're talking about chemo. Those are the main things we're talking about chemo. When we talk about chemo, they're talking about the three goals. Either you kill it, you control it, or you give it for comfort.
Okay. All right. So, Mr. P, now let me ask you something. I know we're talking about chemo, but for the cancer, is there anything that we can, you can do from the preliminary stage, like to start watching for right now, so you cannot get you can get cancer?
That's what we're telling you. Simple thing is
because sometimes it just happens. So you go to the hospital, you eating right, you eating vegetables, you're making sure everything all right, taking your exercise, but when you go, they tell you, say, oh, you got cancer. Sometimes you try to figure out what you've been eating or what been going on, how you got it.
Look at some of these things, okay?
If anybody out there have a question, the number is at the bottom of the screen. Ask your question. Call the number, ask your question, and Mr. P will answer your question, because I may not ask the question you want to ask.
You see, look at some of these things, like some children who will come with leukemia and other things like that. When they find out that their child,
the one that in your blood,
they find out that their child is anemic all the time. Why the child is anemic? You see? They go to anemia, the blood is low, the blood low. Okay, take that child to the hospital, because usually children that are born in the developing, in the industrialized nation like here, we keep your milestone, we keep that record. You come the first day, we check you out, we weigh you. We give you certain vaccine at that particular time. You go for 2 months again, you come back, and then we keep checking. And each time you come, we check, we do a blood test to find out. And those are the things. When we start doing a blood test, it is easy to find out that this person's blood test is either more or it's going down. And then we say, when the doctor know that it's going down, it's not supposed to be that way, then you know right away something happened. That's how you discover it. But on the other hand,
what about the older person?
What about the older person? That's why we ask the older person. The older person got to know, one, you pass the age of 20, 30. That's the time the older person begin to start. You pass the 30, 40, you are at that age. You start checking. When you take your bath, do your set examination of scrotum. Do your set examination of breast tissue. Then later on, you will go to the hospital, like you are in the 40. They say, okay, let's do your PSA as a man, as a young man, young adult going to an older age now, to be 50. Then they do your PSA.
The PSA, the blood test?
No, that your blood test will do to see whether your prostate is all right, it's not cancerous. Okay, but if they do your PSA is high, then you go back to the hospital. They say the PSA is high. Let's check whether or not your prostate is good. Then you lie down, they put a needle on your prostate and take tissue. That's what they call biopsy.
Oh, they put it on it?
They go inside the prostate. They go there, boom, and take the tissue, boom, and take the tissue at least 6 times.
But that's what a lot of guys don't let her do it.
Yeah, but then see that is the examination. That's
you're telling me right now it's scary to go and go.
No, you got
Okay,
to
I
do.
see that a lot of people don't like to
Yes,
go do
that's
this
why
because
many people will say, "Look,
for the men on here, I think you can attest
see?
to that because
see,
when
you
you're
don't-
talking about going to
Yeah,
go,
you go first of all, you go to the hospital. The doctor say you come for physical examination.
Yeah.
Then they give you what we call rectal examination. You know, digital rectal examination. He put the finger into the rectum and then he will palpate this.
yeah, but you see, that I'm telling you, a lot of men would not want to. They don't want for people.
Listen to me. You want to,
You want to live.
you want to live,
Yeah,
and you want to
okay.
check. You say you want to be free.
Yeah.
Go there, lie down on that table. Let
But
the
the way
man
you're
do.
saying it, it's not going to be that like now boom. The way you saying
No, no, no.
Because when you
This is
say
the
that, some people here will be there. Okay.
No, the thing is, the first thing is you go first for the first examination. That the digital. When he touched this prostate, he know that his hand supposed to go around the prostate. But if his hand cannot go around, that is in lie.
So you can go through the anus and you can.
He can go to the
Wow.
the right arm. He go through the right arm. He able to feel the prostate right there.
Mr. P, you got manicure that we can use. Maybe next time we can use so you can be able to show these things to the audience.
The manicure would that you see.
Because
sometimes
we can probably do a outside where I can come to your place and we can, if we can do that so they can see, so the men can see some of these things.
Of course, we can. It will be a time we might be able to buy this. We have to go to the medical store and then get a manicure.
Okay.
Both for both women and then
and-
the breast and then
Okay.
do the screw down and other things like
Yeah.
that. So that we got a different parts. So that when we discussing it, we're telling you say this is what you should see.
Yeah, because
this
it's important because
You see?
most of our people, most of our men and the women, we
You
just
see?
hear, but it's very important that people
Yeah.
get to see these things and know that it's important.
You see, but the
It's
men,
important.
it's easy. You lie down on the table. The man, the doctor will come and just put the finger into the right arm and feel the prostate. If it is big, he will say, okay, you know what? I will send you for a PSA examination. You go there, you know, to do your PSA right away. If it is high, he say, okay, go for biopsy. Okay, he will send you to the hospital. Then they will put you down there and they will come up with a little speculum. But that speculum is to dilate the rectum and bring up the prostate to the forefront. So in that way, that is the pinch, the needle, the biopsy pinch will not be able to touch anything. It will go straight into the prostate. It go there, it take a little
sample.
pinch, sample, and put it into this bottle, and take another sample, put it into the other bottle, take another sample. It got to be 6.
Damn it, but
Okay.
you're feeding pain?
Yeah. You see, when you come from there, you feel pain. When you pee, it will be bloody.
What?
But it will be all right. Don't worry. It will go down.
Jesus
You see,
Christ.
yes, you will feel pain. So when they do it, when you are there, they're doing it. They will not do it under numbness. They will not numb nothing. They will
Wow.
just put you there and take that. They will still will go faster so that it will be finished. So you go boom, 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 boom,
Wow.
boom. Until the 6 bottles are
I'm
all
feeling
right.
the pain already.
So you know that you go there. Then after
Oh,
2
God.
weeks, you go
They're like-
back to the hospital. When you're going back, they are where some of all have been. You go there, all the men line up, all of them line up. But with all these people that line up, it may be only 3 that they will say you don't have
Cancer.
prostate cancer.
Prostate. What?
Yes.
You talking about for it's just, you have to do with just Liberian men or
No. Majority the
people
men that
from
you see
different
that will be both. Majority will be about
Mr.
you
P, I
know,
wish you had the opportunity so I can ready. We need to ready, yeah, so I can call because Liberian men don't let to go to the hospital.
where
They
you
don't like to go to the hospital.
need to go to the hospital. Most of the prostate with the Liberian men, it will not be, majority of them will not be prostate cancer. It will be a benign type.
Okay.
But you can take capsule to shrink that one. It's not benign. It's not something that will spread. It's not cancerous. So you see all the people that will be lined up, they will be there they are going there for the result of the biopsy.
Yeah.
So the doctor call you and say, oh, he will first of all shake your hand. Say, oh, congratulations. So when they say congratulations, that means you're all right, no prostate, no prostate cancer. You go there to say, man, sit down. You know what?
When they say that, you know that's something wrong.
You know what?
Jesus
yes. You will have to be taken. We will send you somewhere else so that we will take the. We don't feel that it is spread. It's something that's spread already.
But that can be treated now. That would.
Yeah, they will treat you again with you're going with the same chemo now. You see?
Okay. That one.
That's the time chemo coming in now. You see?
Well, ladies and gentlemen, the other topic today, I'm just I'm in pain already. So
that's
so if you can call and ask a question, that's it. But listen, let's take a little break, and I gotta digest this. All right.
So
and we'll be right back.
We'll take a break, and we'll be back.
Buddy made it.
Baby, sexy and back, tuck it. Look at her front, tuck it. Look at her back, tuck it. Look at her size, supper. When you see Buju, know that. Did you see Buju and holla? Did you see Buju and run away? Run. Baby, making some US. Whoa. That girl carrying some US. Whoa. Wanna sexy, come on now. Sexy mama, yeah, yo. Laga, liso. Look at you. Look at you. Oh, back on the chest on the play. They play on the downstairs. On yeah, you will get away colors. You will get away colors. And I will get away colors, yes. You will respect, capital B. You will respect, my you in the money child. You will respect, you carry 10, I'm 10. You will respect, 10, I'm 10. Now who can pop on now, baby? Let it try it now, baby. Now who won't compete now, baby? Let it try it now, baby. Okay, look at her back. Look at her front, look at her waist, look at her hips, baby, pam atoma, someday she let her be in G, someday she let her be in dress, someday she let her be in skirt, red, white and blue, international beauty, international body, international baby, international business. They get too expensive, they're more too attractive, they're more too productive. You will respect, capital B. You will respect, my you in the money child. You will respect, you carry 10 over 10. You will respect, 10 over 10. Now who can pop on now, baby? Let it try it now, baby. Now who won't challenge now, baby? Let it try it now, baby. Look at her back, look at her front, look at her waist, look at her hips, baby.
Okay.
Welcome back.
Welcome back.
Listen, if you on here and you don't feel comfortable to call, that's fine. We just had a call and we had to talk to the guy. Listen, this platform, people just gotta understand, this is free, and this is very it's very educative. You gotta call here and talk, because you got Mr. P here, and we'll have other doctors that are gonna be coming on here. Instead of you waiting to go to the hospital before something happens to you, you got access to listen to this, pass it on to somebody else, and you can ask your question. I don't want you to be shy, and feel like people always say, I don't want people to know my business. Yeah. And I'm doing business because if you look in the community, you see a lot of Liberians are dying from cancer. People don't even know every day somebody dying from cancer. Right now we're talking to you, we just received a call the other day that somebody just passed from cancer again. It's serious.
Yeah,
so if you have, we're going to be talking on the topics that Mr. P and Dr. Cooper, they're going to be talking on here. That's something that have to do with us here every day. Like they think the food we're eating, we living. We just that by the grace and help of God.
Yes.
You know, so it's
That's
important that you call, you know, ask your question. For me, I'm blessed to be sitting here every day and be hearing this thing because at least I know how to look, watch or what to watch out for. All right. So it's important that you call the number. Don't be shy. If you can't call right now, keep it after the
after
program.
The program,
you can
then
call. That's
you
why
can
some
call.
people do the same thing. That's it's important.
You don't want nobody to know your business.
Yeah, you want to know your
fine.
business.
No problem.
Then you sitting, you sick, but you want people to know your business.
The early we detect it, the better
it is.
Don't wait until they start treating you chemo with palliation. That become bad.
Yeah.
That become bad. That particular goal is not right. So we don't want it that way. You see, we don't want it that way. That's why you see the only sign and symptom that cancer has is the best way to observe it is to start first of all checking yourself when you are at the particular age. Start checking yourself when you are in the 20s. Check yourself when you go to take baths. Check your scrotum. Okay. Check when you urinating. Check it to make sure that you check you urinating and you have no blood in the urine. People can develop cancer of the bladder, and that can cause you to be urinating with blood in the urine. So once you start feeding pee with blood in the urine, they want to check it out, and if they find out that that's how it is, then we will start putting that blood into perspective to check it, otherwise to make sure where that blood is coming from, you know. So those are the things that happen. And you try to drink enough water in order you're ready to pee, you go to pee. Don't hold the pee back. You keep holding that pee back. Yeah. The pee will travel upstairs instead of coming down. The pee usually is supposed to come downstairs. It's not supposed to be going upstairs. It's supposed to be coming downstairs. But the bladder is full. You see, your kidney secrete 30 cc of urine every hour. 30 cc. So you go for 4 hours. 4 times 3 is 12, so that 120 cc will be in your bladder. You're sitting down there. You stay sitting and you don't want to go pee. You know, you stay sitting down there. It's still being secreted by it's still being released by the kidney. It filtered by the kidney. All right, the kidney now will start when it start going back into the filter. The problem, because when the pee leave the filter, it comes down to the bladder. It's already bad. The kidney does not need it no more. But you sit there and you continue to accumulate it until they go back through the ureters and get back to the filter. You got trouble. You got trouble. You can develop kidney infection, and that kidney infection, you don't treat it, it will be a problem.
Okay, Mr. Freeman. Mr. Freeman on here, he's saying that please remove me from this group. I'm trying to get you out of there. I know some people are not comfortable with this. I don't know how you got in the group, but probably somebody send you the share, and that's how you end up on here. So you probably can remove yourself if you're not comfortable with the program. All right, on Facebook. This is on Facebook. All right. Let me see. Okay, Mr. Freeman. Let me see who else. I'm watching from Sano. Somebody is watching from Sano. I'm watching. My nephew's watching. Nice program. Thanks for the invite. Hello. I'm watching. Amen. Okay. All right. So that's it. Okay, Mr. P. Yeah. Continue.
Yeah. So those are the things that we should do. You don't have a particular symptom except that it is visible. Somebody just reducing in weight. You want to know. You go to the hospital. They want to check all these things. Children reducing in weight, and just like I said, they are not eating, especially in the developed nation. But in Liberia, you don't think about that so much. Perhaps you might be thinking about what we call protein calorie malnutrition with the child. So the child is not eating. Child eating only 1 time a day. They are not supposed to be eating 1 time a day. They're supposed to be eating 3 times a day. You see, with children, we don't go hold them and tell them, say, oh, that their diet should be eating. No, they need everything. They need everything. That's not the time. You can't hold child from eating. Oh, you will get cholesterol. No. Give it to them. Let them eat it. So because they need that cholesterol. They need that particular oil. They need that cholesterol to make bile. So that when the toilet the bile will be excreted into the intestine. It will change the color to be normal. So they need that oil. That oil can be used for energy. That carbohydrate will be used for energy. That protein will be used for energy. So they need protein, carbohydrate, and the fats. You know. So you don't tell them you can't give them the particular diet. This and the only thing you can do that we don't have home is you tell them to eat sweet. That is every Jew, the drinking juice, sweet, and most of the time most people do not have that home. Even milk, you should be giving them milk to drink. Even we don't have that opportunity home. But you can't hold the children back for eating this or eating that. It should be balanced. The balance should just be okay, protein. It should be carbohydrate. It should be a little bit fat. Protein, carbohydrate, fat. Okay, with what we call some vegetable for some vitamin and other things like that. So that for the children is also. But young adults, let's try to check ourselves. When you urinate, look at your urine. When you go in the toilet, look at the toilet. Toilet should not turn white, especially those of us who can be drinking. Those of us who drink a lot of liquor, we should not go in the toilet white, then be thinking about your liver. Then you're developing liver problem, cirrhosis of the liver. You don't have it. Liver, it is not easy to give you another liver. It is not easy to give you another liver. When the liver gone, you're done. That's it. So if you're drinking, if you like to drink, be careful with
just stop drinking. You don't just leave the let's leave the drinking business.
You must think about that.
Yeah,
you're drinking, look at your toilet. Toilet should not be white. You see that one part of the thing there. All right, that one thing. So when you check your scrotum, make sure that the testicle is soft and there are two in there and all that kind of thing. When you pee, the pee should not be hurting you and all that is not normal. You know, when it's hurting you, that means you're thinking if you have sex and the pee hurting you, you think about some transmittable disease. Sometimes you have a urinary tract infection. But if it happens that way, your partner, always check your partner because it should not be in pain. Your partner should go in the bathroom and pee, no trouble. You should pee, no trouble. But you pee, you're having pain. You got to know why your partner, are you sure your partner? Think about that. Okay, your partner say, yeah, I'm sure. Then you must be thinking about yourself. Why am I having pain? Then if you're a man, go to the hospital, check your prostate, because when you start having brand urination, your prostate becoming bigger.
Okay.
That's one of the signs of enlarged prostate.
Yeah, but Mr. P, to check it out at the thing.
But first thing to do is to check your blood, to do your PSA. They will not just put you down and do this. They will first of all, they will just tell you, say, go do your PSA.
Okay.
No, then they take blood from you and do your PSA. Now the PSA come back. Before if they say your PSA is high, then they put you down and do
I'm gonna go do mine.
You see?
I gotta go do mine.
Yeah, you do your PSA first.
Kwame, you listen to this?
You see?
Or Wilfred, Kwame, let me see all the men in our guy. Murphy, everybody on here, you listening, right? It's time for all to hit the doctor.
You know, so you go first and just examination and say, I here to just do my PSA. It's okay. They will send you in the lab. They send you in the lab. You go and they do the blood test. They do your PSA. Fine. If they do your PSA, maybe they will do Chem 18. That means they will do your cardiac enzyme. They will do your, they will make sure that they do your lipid enzyme. Okay, when they finish doing those things, that means they want to know whether you got cholesterol is high, triglyceride is all right. They will check on that. That will be showing that you are far away from heart disease and other things like that. You are far away from high blood pressure and other things like that. They will do those tests for you. Then they do your PSA. Okay, your PSA is all right. Sometimes they will ask you when you pee is okay. Do you feel pain? You say yeah. They will do urinalysis to find out that you don't have urinary tract infection or UTI. So you do your PSA, but when any of those things come back, it is abnormal. Now, then we can go back again for the second test. You see? Especially when the PSA come back is high, then we'll do what we call digital rectal examination. Then after that, when we find out that it's high, then we send you now to do what we call biopsy of the prostate.
I mean, you're in trouble now.
No, you are not in trouble. We still doing tests.
Okay,
we still checking. We still
but
checking.
there's possibility that you may be in trouble.
Yeah, you may be in trouble.
Okay.
One is in lie, you may be in trouble, you don't know.
I hope I'm not making
see?
people scared.
You see?
But it's very important that you go and check yourself.
So you go there and
Wow.
do that. You go there and do that. When you do that, you check it early. They see when you do it early, it's important. It's important. The early time you do this thing is important because even if you are in trouble, it will be killed first time.
So, Mr. P, what's the right time for the for you to check the you say 40?
40, 45, 50.
30s.
No.
Okay,
30
so some
or-
of you that came with certain age
No,
to America,
you know,
call this show and talk to Mr. P. Call. It's very important that you call and ask questions or call after the show. It's very important because, I mean, we don't want people walking around. There are too much people dying from cancer. I mean, it's just happening. People don't understand what's going on. Okay, I know a friend that they had to go into the brain and I don't know, they took something from in the brain. Yeah, but still, didn't make it.
no, it means that it's spread already.
Yeah, they didn't make it.
You see,
It died.
it's spread already.
Die. But Mr.
You
P,
see?
if you have it in the brain, okay, so when if you catch it early, can you get rid of it from the brain?
Yeah.
If it's in the brain, which means already is
If anything on the brain, you will start having headache. When you start having headache, go
Wow.
first and check it. We'll do MRI right there.
so not every headache that regular headache.
It's
is
not
that-
not
Well, it will
always.
be consistent that you always
Yes,
be feeding
you-
it and
the
be
person
feeding
will
it.
always feel headache.
Okay.
The person will always feel headache and headache and headache and headache,
Okay.
all like that. We got migraine headache. People can have. They will tell you that why when you say we're having headache, say what part of your hair is hurting? You say my hair hurting one side. Our mind will go straight on migraine headache. Okay. We'll give you few type of. They will give you few type of pills. You will take this and that. Then you go back to the hospital again. The doctor will ask you, okay, the pill I gave you when you took it, did you feel all right? Was it headache there? Say, oh no, it was not there. When you feeling headache, you want to feel like that. You want to vomit. You feel nausea. Yes, that is migraine headache. That's how it come. All right. Then somebody will come and say, I have headache. Okay, what part of your hair hurt? You say, my hair hurting to the back part. Let's check your pressure. Pressure up. Okay. Because your pressure was all your hair is hurting and it's hurting to the back part and your pressure is up. You got hypertension. You continue, you can develop stroke.
Okay.
They don't want it that way.
Right.
Then you say my hair hurting, but it hurt all over. I just feel all over, but it always like it just keep hurting. Not too much, but it just keep hurting. Go to the hospital. Something is pressing on something.
Yeah.
That's why you're feeling. If it is on the thing, so now you can develop meningitis. You don't know that, but you go back and do your blood check. Then they will go and do you have fever or other thing like that? You don't know. They go back there and do MRI. Why the head is hurting? It's easy that way. They can detect it easy that way. If anything is growing.
Okay.
You see? But when you wait, when anything happening to you, you stay suppressing the feeling. No, you will make it more. You will make it to
taking
where you
Tylenol,
yeah.
they take Tylenol, they
You
take
see-
aspirin, they take
You
all kind
don't
of
just
thing
take
there.
it like that. You don't just take those things like that. No, you don't just take it like that way. That's not the way. So you start checking yourself from this time. You start checking yourself. You do colonoscopy. You get up. They do chest X-ray. You go. They will do EKG on you. When your EKG, when any PVC on it, when they find out that your rhythm is 50 below, and you're developing asystole at a certain time, then they start giving you what we call 24-hour EKG.
Yeah.
Why is it your heart is not pumping properly? You see, because men are all you can be sitting down, then your heart will be boo 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 boo. Then something is start. Then you say, oh, maybe I eat too much or something.
Oh, so now thinking on something.
Yeah, I'm thinking on something. Yeah. Another way, your heart beat boo 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 boo. It go into a rhythm. It go to that rhythm like you have couplet, you have triplets. That what we call ventricular tachycardia. But which type? You went to couplet, you went to triplet, or you went to PVC, trigemini, all these things, you go into it. When we find that on your EKG, then we know that something is going on. You're having extra heartbeat. We want to find out. You got to be on the medication. Don't sit there when you're having extra heartbeat, because your heartbeat beating is supposed to be loved up. But when you between that love and dub, when we feel another beat, when we put you on the EKG, it will show to all right away on the EKG. Then we're telling you, say, you got to be on this way, you got to do this, we got to then start educating you. So those are the things that we're talking about here. You want to live long, you got to follow these things little by little. Go to the doctor. Go to the doctor and check the doctor. When you go to the doctor to check your doctor, and majority of all, it is what we call, majority of people coming from Liberia, you know, either you may not all be exposed to TB. TB have been all
whenever you go for the test,
you see, by the time you come to do PPD, when we do your PPD, it's positive. You do your PPD, it's positive. But when you do your chest X-ray, it doesn't show anything on the screen. So when that film tell all that nothing on your thing, but you may have been exposed to TB, or you may have gotten the BCG vaccine, okay, that's why your PPD was positive. You see? But let's say you are not eating. Some men all back home, we eat one time a day. We are protein, calorie, malnutrition. You see? You skin it like anything. You got to come and do your protein. You are protein deficiency. Want to do it right now? It will show. It will be positive.
Yeah.
It will be positive. So when you go back there to do your chest X-ray, it will be good. There will be nothing to show on the X-ray. You see? So those are some of the things that you got to be careful. You come, they will do that chest X-ray. You come, they will do VDRL, all that kind of things for what we call venereal disease research and laboratory. Those are some of the tests that they will want to do. What they're looking for, we're looking for syphilis. We'll talk about syphilis when we come back.
Yeah.
We're looking for syphilis because when syphilis get on you, you will see all kind of knot on the penis, but that knot will be hard and you can't feed it. You see? That's how syphilis go. Now it will continue, and syphilis, it can attack the brain easily. But we'll talk about it when we come back.
Some people asking questions. Some of the questions you're asking here, I'm not going to like Mr. P to answer this thing, because you see, I'm reading the question here. We're not trying to be sarcastic on here. Okay, so try to be respectful. You see that? They're asking over there. I mean, we don't want to be, you know.
Where? Over here?
Yeah, right there.
You say you call this.
No, don't read it, Mr. P. Just look at it. You see what he's saying here.
Okay, that's an examination. It is good for that examination. Yeah, he got to do it himself. Over there, he know that he in the age. Yeah. He got to do his prostate.
But listen, he's sitting with another president, and it's happening. That's why they're asking the question.
No, I don't think he's sitting on the examination table.
No. Look here. You see, he's sitting with somebody else, and so that I would discuss.
Oh, okay, but don't know that one. We're not talking about. We're talking about medical things, because over there, those are diplomatic programs.
Okay, we don't want to do that.
We're talking about medical things.
So just watch your language and watch what you're putting on here, because I think I'm getting the message over here. Okay, so if nobody got any question,
you know,
and you think everything is okay, you can call after the show have ended.
Yeah.
What time is it now? After
it's just 12 o'clock.
12 o'clock.
We were supposed to discuss something about malaria. Malaria,
yeah.
which is the our stable disease back home.
Yeah, back
because
home.
We are in West Africa, in underdeveloped country. Our stable disease, like we say, our stable food is rice. Our stable disease is malaria.
Yes.
You see, so majority of all are, you know, we develop resistance to malaria. You see, when you come to like America, you become resistant. The resistance you develop back home, it will wear out. By the time you go back home, you stay there 1 week and malaria, when a mosquito bite you, you finish.
You say, yeah, that's why you go to take your.
You see, before you take your Daraprim before you go. You see, so we will discuss malaria. We will discuss malaria. Hopefully, when we come back.
Yeah, we'll come back.
We'll come back on the, I think, Monday or so.
Yeah, Monday, because we're not here on the weekend.
We're not here on the weekend. We'll discuss malaria and syphilis.
Okay.
We'll discuss malaria and syphilis, but we had discussed that. We already discussed, you know, in West Africa, especially in the developing nations in West Africa, the diseases that we get there is, those diseases are malaria, typhoid fever, amoeba, amoebic dysentery, bacillary dysentery. Those are the diseases, especially typhoid fever, malaria, the dysentery. Those are the ones that we got. So every one of you be careful, because you come in here, you can have amoebic circulating. You know, the time you get a disease until you find a symptom, we call that incubation period. In that incubation period, you got your visa
so
with
it's generating there. It's just coming up.
At that time, it's developing in your you will not feel any symptom. Now you got your visa between the time. All of a sudden, you got on the plane and came. Now, by the time you come here, we give you the first water, the first clean water we got here. We'll give it to you. By the time you drink that, you start having problem. You go in the bathroom.
Yeah.
Now, when you come here, you start going in the bathroom. We carry you to urgent care. Here, the people do not take too much. When they start doing stool analysis, you know what they're talking about now? Then the thing say, they will ask you, did you travel out of the country a few days ago, or you just coming from out of the country? By the time you tell them you coming from out of the country, they think about Ebola.
Yeah.
That will buy the business. So when you coming into this country here, before you get your malaria, before you get your visa, before you get on that plane, all these people that are coming, oh CDC, oh this, they are not here for 5 minutes because they will soon be going back. If they stay here for more than 2 weeks and then develop headache, they better go back, because you can't be having headache and you come here and you say we must take you to urgent care. You go back to urgent care, they will first of all ask you when you just coming from the country or coming from outside the country. When you say yeah, they will give you something to say leave. That urgent care will call the immigration and they will tell you to leave. You will go right back with that headache. You see, you will go right back with that headache. That's how they have been. That's how the healthcare delivery system is now. That's why you go to the hospital, they will tell you, have you been outside the country a year ago or so? You say no. Okay, fine. They don't expect any diarrhea cases with you. They don't expect malaria cases with you. They don't expect any dysentery diarrhea cases with you. They expect, let's check your pressure. Let's check your prostate. Let's check your blood sugar. Those are the things they checking. Those are the things we do here. Those are the kind of diseases that we look for here. We look for your blood sugar. We look for your blood pressure. We look for your EKG. Okay. We look to give you nebulizer because you're having asthma. These are the things we're doing. Okay? But you come here, you come with diarrhea cases. The things say you're coming from Africa and you got Ebola. They will send you back. They will send you back. So be careful. When you guys come here, be careful. And when you got malaria, they're not giving you chloroquine right here. Some of them will tell you, say, okay, you know that he got virus. That's what they will tell you. They will not diagnose malaria. They will tell you, say, you got virus. You got Nile Valley virus. That's what they will tell you. You see? You know, and they didn't do anything for you. So they gave you Tylenol, you take it, but you got the malaria.
And that's not good.
And it's not good.
If
good. That malaria go by, you get it without treatment. It get into your bloodstream, you start having seizure. And anytime somebody has seizure, there's a trouble to the brain.
Which means you have chronic malaria.
Yeah,
right?
that chronic malaria, you have seizure. When you start having seizure,
you go crazy.
Yes.
Yeah.
You become unconscious, you go to coma, and you die right there. Malaria kill you. You see? So we'll talk about malaria when we come back. But these are the things that when you come here, you don't go to the urgent care or the hospital and tell the people, say, oh, I'm just coming from Liberia or coming from Africa, this and that. And you come with all kind of symptoms. They will be very careful touching you. But one, they tell you, say, you're coming from out of the country, you say, I'm coming from Africa. The next minute, everybody that coming around you will be in complete gown.
Yeah.
Complete yellow gown with all hair gear, everything.
Quarantine, right?
They want to quarantine you before they touch you.
They quarantine you.
Okay? So all our CDC people that come in, we pray that they will be like that until they go right back to the same CDC. Okay? They go right back to the CDC.
See, that's the thing is, that's the sorrowful thing that we got all the professionals in America, in Australia, outside. You know, and we got a country where we cannot encourage or create an environment for these people to go back and perform the job, what people will have good health care. Everybody just stuck. And I always say that it's not an easy thing to let a man who's working outside, got all the facility, everything to leave from here and just transition and just go back home. You got to create and you got to reach out. So it would be a nice thing to have a platform like this where we would try when the team get ready. I want to see if we can get in touch with doctor, doctor in Liberia, where you guys can interact, so people can, so you can help them out, because there are a lot of things they need to know, and I mean, it's just frustrating, you know. So okay, if you don't have no questions, I guess we're gonna cover this the day. Thank you for watching, and we hope to be back here on Monday.
Yeah.
And if you also have a topic, hold on 1 second, we got a call coming in. Hello, your name and where you calling from? Hello, your name and where you calling from?
Hello.
Oh, okay. Listen, I'll call you back. Okay, let me close up. We'll call you right back. So, if you don't have no question, or share the video to somebody, and let them. They can have the replay, and we'll come back here on Monday and continue. All right. Thank you so much for watching.
We'll be discussing malaria, syphilis, so that we'll be careful with how we get these things, and be very careful how to take care of ourselves, and other things like that. So y'all share the video for us. This is Lrtn, Liberian Radio and Television Network, based here in Philadelphia,
in
Pennsylvania.
Okay, so we live, and we will be back here on Monday, and we hope to see you guys again. So if you have any questions, you can call and call us, and numbers always on the screen. Thank you so much for watching. Okay. Okay, you're watching? Because we're on the health. This is the health segment. You're watching? Hold on 1 second. Okay, yeah, go ahead. We're talking on health. Mr. P was talking about how you call this thing?
We're talking about chemotherapy. And the goals.
Oh, okay, that's AB. You're just from Liberia. You just from Liberia. Yeah, that's my buddy. Just coming from Liberia. Oh, he gone. Okay, we're gonna leave it for now, and we'll see you guys on Monday. And I'll probably be doing an outside broadcast. We're still trying to get everybody to call the White House for the DED and the TPS that are about to expire. So keep watching. We're going to go out, do an outside broadcast. We're still talking to people in the community to see what's the solution and means that we can come together as Liberian to help our people to not be deported from all of Liberia. So thank you for all America. Thank you very much.